Let's take you to West Africa and East Africa. Nigeria, firstly, has received about 3.9 million doses of AstraZeneca vaccine today. Our correspondent there, Phil Ihaza, joining us live from Abuja. And also, let's go to Kenya, expected to receive its share of the COVAX vaccine tonight. And there we find our correspondent, Kimani, in Nairobi. Thank you both. Let me start with you, Phil. So nearly 4 million doses for Nigeria. It sounds a lot, but I guess this is in the context of a massive population.
Thank you, Francis. Indeed, first of all, I must say it's a historic moment for Nigeria because this is exactly 368 days after the first coronavirus case was detected in the country. And so whether or not it's 100,000 doses, whether or not it's a million, but in this case, about 4 million doses of vaccines, indeed, it is a significant step towards the end of the outbreak, the pandemic in Nigeria. Well, of course, I was at the airport, the international airport, the Nnamdi Azikiwe airport in Abuja, and quite a number of authorities, health officials were very excited with the fact that months of speculations have finally ended and the vaccines, the first batch of vaccines are here. So indeed, the country has over 200 million in population, and it's looking at inoculating about 70% of its population by 2022. So if this 4 million can really be administered effectively, indeed more vaccines are expected. And according to the UNICEF representative in Nigeria, who of course UNICEF supervised this transfer of the vaccines, he says that the 4 million will go a long way, first of all because you're looking at health workers, you're looking at top government officials, security officials, and frontline responders. So it will go a long way, but of course that depends on the other vaccines that are coming in. We're still expecting about over 10 million before the end of the first quarter.
All right, so about 4 million have landed. Sarah, then in Nairobi, how does that compare to what Kenya is expecting? I think you are also at the airport waiting for a midnight flight.
Yes, indeed, at the Jomo Kenyatta International Airport, where in about 3 hours, in just under 3 hours, we're expecting at least 1 million COVID-19 vaccine doses to come in. All this part of the COVAX facility donation to Kenya. We expect that once it gets here, it's going to be received by a high-level delegation of government officials, and then from here it will be taken to cold storage facilities not very far away from the airport. Tomorrow, we understand that they will be going through the process of ensuring that they secure the vaccines, putting barcodes, ensuring that they now again start distributing to the regions. We understand they have divided the country into 9 regions, so it will be divided into those 9 regions, and then on Friday they will administer the first doses. We understand this particular consignment is reserved for essential workers. This includes healthcare workers, teachers, security officials, for example, the immigration officers who work here at the airport. And then in 2 months' time, the country expects to get more, and now this will go to more essential workers, what they call essential workers, the people in the hospitality industry, journalists, thank God. And then after that, whatever remains will be given to the vulnerable members of society, especially now the aged. And the government is aiming to at least administer 9.7 million vaccines by the end of this year.
All right, so ambitious targets, and we're seeing the same thing basically everywhere. Phil, back to you in Abuja, Nigeria. I'm interested into the context in Nigeria into which these millions of doses arrive. Firstly, is there a lockdown? How are Nigerians coping right now? And what sort of attitude is there to the vaccines? We saw a lot of fake news and mythology around vaccines here in South Africa.
Well, Francis, that's a very brilliant question, talking about the apathy, talking about the myth around taking vaccines in Nigeria. Like you rightly said, there's been a lot of fake news, conspiracy theories, peddled in the news amongst Nigerians. And if you go on the streets, yes, there's an excitement that the vaccines have arrived, but not many people are really, anticipating the jab. So the government really has a lot more to do in terms of educating the populace. In fact, we're talking to some authorities at the airport regarding this issue, and they said that quite a number of effort has been targeted towards ensuring that Nigerians actually see this as something that is really positive, see this as a life-saving opportunity. In fact, one way to actually make that statement resounding is the fact that the president, the vice president, top government officials will be receiving their first jobs in a couple of days, as a way to show that indeed this is something that the country needs. And beyond the vaccines, the health authorities have also said that the non-pharmaceutical measures like wearing a face mask, social distancing, and a couple of others will still be practiced, because you're talking about 4 million doses in a country where we have over 200 million people. So that dose, we cannot relent on our oars. We cannot be complacent in terms of ensuring or adhering to the health protocols.
All right, so education is a big issue. Sarah, tell us more about the finances here. I mean, it was interesting that the COVAX facility, people are a bit confused. Are these straight donations, or is Kenya contributing to COVAX like South Africa is? Are there going to be supplementary efforts? I'm sure Kenya will also be trying to deal with manufacturers directly to get those numbers, to get up to herd immunity.
Well, Kenya is among the countries that contributed to the fund that was set up by the African Union to be able to secure and to buy vaccines for the continent. I'm not very sure if they have contributed anything to the COVAX facility. However, President Kenyatta has been among the African Union leaders that have pushed very hard to have debts removed so that the countries on the continent can be able to afford vaccines. But they have also been working very closely with the outgoing president, the chairperson of the African Union Commission, President Cyril Ramaphosa, and they have been talking about the need to have Africa not forgotten, especially at this time. So they have been talking a lot about, vaccine diplomacy, talking about the need to ensure that all African countries are vaccinated, saying that the West cannot be safe unless the continent is safe. And so I guess that is one of the reasons why Kenya is among the first countries to get the doses. It's also important to note that the country has a very robust national immunization program, probably because of her neighbors, South Sudan and Somalia, where once in a while we get outbreaks of polio. And so they have been having these regular immunization programs. For example, when we were speaking to the Minister of Health earlier in the day, he was saying that they only trained about 400 more healthcare workers to be able to administer these vaccines. And they're saying that they have enough storage facilities to be able to take in as much as possible. Indeed, Kenya is saying that apart from these vaccines from COVAX, they have ordered 24 million vaccines. And so they are hoping if they get this, then they will be able to cover at least 30% of the country's population by 2023.
All right, thank you very much. So herd immunity a long way away, but we are seeing vaccines being delivered today in Lesotho, Angola, in Southern Africa. Earlier we were talking about that, and also in West Africa and East Africa. That was Phil Ihaza in Abuja in Nigeria, and Sarah Kimani in Nairobi in Kenya. Thank you very much. Now let's move